This is Revival in Reformation Television. Keep watching. Welcome to Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy. Let's join the discussion now. God bless you.
Hello, viewers all around the globe. You're welcome to Health Matters on Arab TV. How are we doing? I hope you're keeping healthy, you're taking enough water, exercising and resting. I have an important topic to discuss with us today. Joining me to dissect and to look at this topic, nitty-gritty of it, I have a woman of God with me. She is a medical doctor and she's a senior resident of the Department of Anesthesia in LASUT here in Lagos. She's married also to a medical doctor, a man of God, and she's a mother of blessed and wonderful children. Please join me as I welcome Dr. Mrs. Ayobami Odedepo.
Good morning, ma.
You're welcome, ma.
Thank you,
You're
ma.
welcome. Viewers, I want you to please relax. If you're joining us for the first time, this is Health Matters on Arab TV. Please subscribe, share, comment. But relax now. Take water and relax. We have an important topic to discuss. We want to discuss the topic breast cancer. Breast cancer is one of the deadliest and most common cancer in the world right now. And as believers, we must be knowledgeable about this. We must know what to do at every given time. We must not be in the dark of it. And that is what we want to do. So I want you to take our phone and take points as we bring them up. And you can also make comments and later maybe make inquiries. So, Doctor, you're welcome once again, ma.
Thank you, ma.
What is breast cancer?
Okay, so breast cancer is one of the most world-leading cancers that affects the breast, be it in a woman or in a man.
So it can also affect the man?
Yes, it can. It's just that the incidence, the percentage of the chances of it affecting men is reduced. You can't compare it to that of a woman.
So should we say like a 97 to 3 or 90 to 10?
Yeah, so some journals will say about 1% in men.
Okay.
So
it's more of a woman's sickness.
Yes.
It's peculiar to the women.
Yes.
Just like prostate is peculiar to the men.
Yes. But it's just that in prostate cancer cannot be in women, but breast cancer can still
be in a man. Okay. So can you tell us, how does this thing happen in the life of a woman? What causes it?
Okay, thank you, ma, for that question. For those of us that know and we don't know, many of the cancers we have can't actually be linked to a particular cause. So many a times what we have concerning the cancers are risk factors. You just have a whole lot of factors that will tell you that, okay, this can predispose to it, that can predispose to it, but being linked to a particular cause for cancers is usually, for example, let's say malaria now. We know that, it is mosquitoes. It's when you are being bit by a female Anopheles mosquito transmitting plasmodium to you, that will cause malaria. But for cancers, you actually can't. There is no causative organism. There is nothing you can say in particular, but we have risk factors. So for breast cancer now, the risk factors that have been noticed to be associated with breast cancer includes the female gender. Like we've already said, most times it's as if it's a cancer of women. So the fact that you are a woman, there is already a risk factor to it. You are a woman, you have breasts, there is a risk. That's a risk factor already. And for people that probably have a family history of breast cancer, maybe had a sister that had breast cancer.
So it's hereditary.
Yeah, not hereditary, but there is a family predisposition. So when we say hereditary, it means that, oh, your father has this, you would have it, or the fact that the father has it, like 2 of the kids. So someone in the family could have breast cancer. Eventually, none of the kids might have it, but they just have to be conscious of the fact that there is someone in the family that had it, so they would have to pay more attention to themselves too. So there is a family predisposition to it, and not just to breast cancer, to cancers generally. There is a family predisposition to it. And also hormone replacement therapy has been linked to breast cancer for women that take hormones for different things. Be it for IVF, that's for that, or for as contraceptives. For any reason, you have to take hormone. There is a risk factor to coming down to with breast cancer.
That you're taking birth control contraceptive.
Yes, is a risk factor. But it's just that all of these things is not it doesn't mean that the fact that you're taking it, you are going to
have it.
Yes, it's
just like it's a risk factor.
Yes,
you might have it.
You might. So for some people now that now have 2, 3 of these risk factors, it increases their chances of now having it. Someone in the family already had breast cancer before. This same person is taking hormone for whatsoever reason. Smoking is also a risk factor for breast cancer, for different cancers actually, but breast cancer has also been associated with smoking. So you can imagine someone smoking, has a family history of breast cancer, is taking hormone for whatsoever reason. You're already, for such a person, the chances of coming down with breast cancer is increasing with each of the risk factors that this person has.
Exposed to.
Yes. So those are some of the risk factors, and also for age. But right now, medicine is evolving. We are seeing things that in the books has not been. So in the books, we'll still see that, okay, age incidence from 45, 40. But nowadays, we see people way younger than that coming down with.
Doctor, like from what age have you seen now?
I've seen
Teenagers?
a lady in her 20s. I've not seen a teenager with breast cancer.
20s,
yes, but I've seen a lady in her 20s. Yes, in her 20s that just had a baby. So just the first child, she was in her 20s with breast cancer. I've seen that before. For teenagers and all of that, what we usually find in them is what we call fibroadenoma. Is a benign breast lesion. Yes. So usually it's a benign form of breast disease. It's not cancerous. Yes. So for medicine, it is never say never. As long as someone has a lump in the breast, that lump should be removed, and not just removed. You must do an histology on that tissue that has been removed. It is very important. Now, in fact, any tissue that is being removed in the body for whatsoever reason, maybe there is a growth somewhere, they have to remove it. It has to be sent for histology. So histology would help to check the tissue that was removed. Is this tissue cancerous? Is it a benign growth? Do we have to worry about it? Should we just ignore? So histology will tell us that.
Okay. Concerning that lump, I'm still going to come back to it because I know that there's some things that our viewers will want to know concerning that. But talking about those risk factors, I don't know if you have exhausted them. You got to the place of age before I asked that question. Are there other risk factors?
So another risk factor that has been associated is exposure to radiation. That's another risk factor that has been picked to. Maybe someone that is always being exposed to X-rays, different form of radiations. Yes, it's also a risk factor.
So then, when you talk about radiation, what about place of work?
Yes, so
maybe those who are, maybe in a factory, can it?
So except if they are using some form of radiations for their work. for example, people that maybe because of my field that I'm aware of that are exposed to so much of radiation is radiographers, radiologists, and all of that keep taking shots with X-ray. But what they do at work is they also have protective equipment that they put on to protect them from the exposure.
So if you are working in a place where there's much radiation, it's very important for you to have.
Yes, you should. It's part of workplace
precautions. We're noting that. Any other risk factor, ma'am?
Yeah, those are the
major risk factors that we have
associated with breast cancer.
Breast cancer. So you have talked about family history. You have talked about the issue of hormone, taking of hormones, both for those who want to do IVF and also maybe for birth control. What about hormones that are taken for changes in our organs and all of that? Does it, those who change from, let's say, from male now to female and stuff, are they at risk also?
Yes, they are.
As long as you're taking any hormone to change something in your body.
As long as you are.
Please, let's take note of that. Then from ages 20 now, maybe before, maybe we could say 40, 50, but now, like the doctor said, even from age 20, and then she also talked about radiation. But one good thing is that if you know that you're exposed to radiation, please put on a protection concerning it because you are at risk of it. I want to come back to that lump before we even go to any other thing. You detect a lump in your body. How do you detect that lump? I want you to tell us. How do we know that I have a lump in my body before I even say, okay, let me go to the doctor to go and show this? How do I, as a woman, detect that I have a lump in my breast?
Okay, thank you, Ma, for that question. So what we advocate for now is that as individuals, you should know your body. Understand your body. You must be able to detect when there's something wrong at any point. So for women, every month you should always do what we call breast self-examination.
Okay.
You must always examine your breast. So when you are used to knowing the normal texture of your breast, then when there is something different there, you would know that, oh, when I checked this the last time, I didn't feel any lump here. I didn't feel something that feels like a bean seed in my breast. Now I'm feeling it, you would know. So the first thing, but if you are not used to doing the breast self-examination, then you might not be able to pick when things are actually going wrong. And the best thing for this cancer, the best part is when it is picked early, the chances of survival, it's very high when it is actually picked early. Or some people would notice early but won't still present early. So when you pick it early, you should present early. It's not enough for you to know that there is a lump and you're just there and you're just telling people, I felt a lump, and you're not doing anything about it. So it's not enough to even notice it early. The best thing is for you to now present early after you must have noticed the lump. So there is a way in which we do the breast examination. I don't know if my explanation is best explained with probably a mannequin where we but I can just say it, so at least some people. So it is you do the breast examination using the flat of your palm. Yes, so you don't poke. You don't use the tip. Yes, you don't use the tip. Is the palm. That's what you use. Then you do an imaginary division of your breast into 4 quadrants, into 4 parts. So you imagine that, okay, this is the breast. I'm dividing it into 4. Okay. So you have upper, inner, upper, outer. Okay. Then there is a lower inner quadrant and the lower outer quadrant. So the examination is done in those 4 quadrants, because if it is not done systematically that way, you just keep pressing, you really don't know what you're doing. But when you have it in 4, so first thing, okay, you are checking the inner upper part.
With the underneath of your palm, pressing on it.
Yes, so something like this, ma. Here. So I can do like this.
Okay.
Yes.
Here.
Yes.
Okay. The back of your
fingers.
fingers.
Fingers. Okay. So I do something like this. Okay. There is nothing there. Then you go to the lower
You
inner.
need to press it hard.
No, you don't need to press it hard. What we say, you palpate. That's the medical term. You just touch. You don't need to press it hard. Like you are just feeling. You rub. You feel okay. Is there anything different? Then you go to the lower one. You check there too. Then you go to the outer part, upper and the lower. You check. Then after you must have checked for the 4 quadrant, then around the nipple area, you check. Yeah, you check that. Then you press the nipple. For some people, the earliest sign they see is that there is a nipple discharge that could be bloody or whatsoever.
And not that you are breastfeeding.
Yes, person is not breastfeeding.
Okay.
And for some people, that's just what they notice. That, okay, there is a nipple, they didn't feel any lump.
Can I pause you?
All right.
That bringing out of either any substance from the nipple, does that mean that there has been a lump for a while and that the woman did not detect it? Or could it also be that immediately that's what will start coming out?
Okay, so for that, like I mentioned earlier, for breast, everything about breast is not cancer. So someone might have that and it's actually not cancer. There's something we call prolactinoma. So it could be that the prolactin in that person, that prolactin ensures breast milk secretion. So for whatsoever reason, it could be in high, the production could be high in that
Even
woman.
when you are not
Yes, even when even when the person is not nursing. It could be a tumor in the brain that is actually causing the secretion of that prolactin.
Okay.
So the person will be lactating. So by the time the person presents, the test they would do would help to decipher if, okay, this is as a result of hormonal secretion, hypersecretion of a particular hormone, or a breast disease, actually. So all of these things, it's even when you find a lump in the breast, it doesn't mean it is breast cancer until you present and histology is done on the tissue. That's when they can say, oh, okay, this is breast cancer. So people actually should not get frightened when they notice anything different in their breast, that, oh, this is different, oh, I can feel this, I can feel that, and they're already nailing themselves to a particular diagnosis, or they've gone to Google and Google is saying, oh, the probability of you having this one is that. So just be calm about it. But when you pick anything, present, go to the hospital and present. So that way it helps with the diagnosis of whatever it's maybe.
Thank you, doctor. I like, if you're just joining us, we're talking about breast cancer. And I like the way you have, because like you mentioned, early detection can save you a lot from the cancer. If you detect it, as she has said, using the outer and the inner
quadrants,
demonstration now with the back of your fingers, not the tip but the back. Any lump, don't get frightened. Just present, using our word now, present yourself to a medical doctor. Don't be frightened. Just let them look at it. It may not be cancerous. And even if it is cancerous, because you detected it early, it can be treated.
Yeah, it helps with the treatment and the prognosis, the outcome of the treatment when it is actually detected early.
She calls it breast self-examination. How many times do we need to do this? Is it monthly? Is it quarterly?
So for your self-examination, it's best done monthly. And also it's been said that immediately after menses, the menstrual period, you can actually do, because around the time of ovulation, there are already different changes that happens that occurs in the body of a woman. So you might not be able to identify if this is as a result of ovulation. Probably the breast is fuller now, breast tissues and all of that. So, but after the menses, the 5 days of the menstruation, you could just take that as your own routine period. That, okay, I know that after my period, I would
do the breast self-examination.
Yes,
I hope you've gotten that. But that brings me to another question. Okay, what about those who are in their menopause? What about those who are no more having menstrual cycle? They have passed that age. So how often should they do? Or they are not, they don't have any risk of having cancer?
The risk is still there. So for people that are menopausal, they could just pick a particular time because you want to be consistent with it, and just say, okay, maybe it's the first day of the month, I will be checking. They will just pick a day to check. And for them also, for women 40, 45 years and above, there's what we call mammogram that is being, they are being expected to do. So when they go for the mammogram, that helps to pick if there is any unusual tissue in the breast and all of that. So they go for the mammogram. So it's
just to see
yes,
if there's anything
yes,
wrong with your breast.
Wrong with
From
it.
the ages of 40
yes,
and above.
It's just part of the routine that is being suggested for them, that when you are 40, and the same way we suggest you must always ensure that you check your blood pressure regularly. For women, say, had mammogram, had cervical screening, to the routine things you do when you get
that
to
mammogram,
that age.
is it like once in 1 year or once in like 5 years?
Yeah, so some will say once in 4 years, once in 5 years.
Okay.
You could
So
just go for
viewers, we're
mammogram.
hearing that you could carry out a mammogram on your breast, maybe once in 4, once in 5 years. For elderly, from 40 up till like what age? Are we looking 60, 70? Do they need to still do that?
For 70, I am not sure I've seen anyone in 70s with
Has a
breast
breast
cancer. Usually that age, they call maybe endometrial cancer. They have some other forms of cancer. I'm not sure I've seen someone.
So should you say between 40 and 60?
Yes.
Between 40 and 60?
Yes, they could keep going for the mammogram.
Thank you, doctor. Now we have tried to, like, doctor will explain the causes, the risk, she calls it, the risk factors that can expose you to breast cancer. We've talked about the issue of the lump, because that's where it starts from. Okay? Now, you detected the lump. You've gone to present yourself to the doctor. And the doctor now says, truly, it is cancerous. What's the next step?
Okay. Before I answer that question, ma, it is not all breast cancer that starts with lump.
Okay, thank you for that.
So there are some other things that some people would experience that is actually not lump.
Please tell us.
So there are changes. So like I said earlier, you should get used to knowing what your normal breast feels like. For some people, it is changes in the skin of the breast. It is actually not lump. They just notice that the breast looks different. The skin, there's what we call like a pitting. It feels like the peel of orange. That's pocketing.
Okay,
that
yes.
yes.
Okay.
So for some people, that's what just they will see.
All around
The breast. That's what they will
Change
say.
in the color
Yeah,
of the skin.
in the color, in the texture. You feel that this skin is not smooth. There seems to be some pocketing. And some people, it is the nipple. They don't know that the shape of the nipple is changed.
It's changed.
It's gone in. For some of them, it's get retracted. It goes in. And they are wondering what is happening. Yes. So for some people, it's actually not lump. They see. So when you notice any of those changes, be it lump, and for some it is not lump. You know, lump feels sometimes it could be big, it could be small. For some people, it's actually not lump. They just feel like, I've seen a woman before that felt that it was boil that she had on the breast.
On the breast.
Yes.
Is it on the nipple or just
no,
part?
on a part of her breast. She felt it was breast. That was her description of
it. Was on the outer part.
Yes, but she just thought it was boil, and boil. Yes, wow. It was, and she didn't know it was. So any change that you pick on the breast is what's presenting at the hospital for. Actually, let a medical personnel examine. Let them reassure you that okay, this is what it is, and it is not what you are thinking of, and all of that. In lactating mothers, also there is what we call mastitis. So that one is just infection of a breast nodule. So for someone that is lactating that has that mastitis, but it is better to still present. Let's just say, okay, this is mastitis. Then when they give antibiotics,
you're fine.
Yes, it resolves. Rather than you telling yourself, no, this is it. It is not that. And each time for every day you delay, at the presentation,
Yes.
the disease keeps getting worse, keeps getting
growing.
yes. So it is better because breast disease is actually has a broad spectrum from the very benign one to the cancerous one. But you really won't be able to say if this is a benign form, if this is just an infection.
If you don't present yourself,
if you don't present for it to be picked early and say, oh, this is what this is, by the time we give this medication, it will be fine. Or by the time this lump is removed, it will be fine. So the best thing, when you notice anything, just present to the hospital.
Thank you, Dr. Oyedepo. Viewers, we just have to tell ourselves, truth at this point. Please don't let us be frightened. She has told us, she's a woman, so she understands. Present yourself to a medical. In our churches, for every church, at least will have one doctor. And even if your church does not have a doctor, you have a doctor friend. You have somebody that you can, please, this is the issue. And say, okay, come to the hospital. Let's check you out. And like she has said, it's not just a lump now. It could be the skin texture at the breast. It could be your nipple. The most important thing is that immediately you see any changes in your breast that is not the normal one that you know, please present yourself. It is not a death sentence, please. And like she have said, early detection, early presentation, early medication can save your life. It's very important. Thank you very much, Dr. Ayobami. Yes. We're looking forward to having you again. Viewers, please, I would advise that you subscribe. I would advise that you comment, and we'll definitely put doctor's contact on the screen so that in case you have a direct question to her. But if we're just going to do a recap, early detection can prevent you. Early, just do that outer and inner, cutting, dividing your breast into 4, and then do the outer and the inner every month. And best immediately after menstrual cycle, every month you do that. And like we have mentioned, you can always go back and also listen again. But she has mentioned also, and what I will just summarize that is that when you detect any difference in your breast, present yourself. I like that word of presentation. Present yourself. Don't hide yourself in the house. Don't lay your hands alone. It's good for us to pray because we are believers. It's good for us to pray. You can lay your hands on your breast and pray and decree and declare and uproot. But please, faith without works is no faith. Don't present yourself. After you have prayed, present yourself. All they need to now tell you is that you don't have it. And then you know you're good. And if you do it early, like she said, because from everything that you have told me now, it is a case of if you detect it early, you're as good as you're safe. No problem at all.
Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy. This is Revival and Reformation Television. Keep watching.